I want to thank our witnesses for joining us this morning. Our country is in the midst of an opioid epidemic that has hit close to home for so many Americans. In 2017, there were 4,854 total unintentional drug overdose deaths in Ohio alone. Illicit fentanyl and related drugs were involved in more than 70% of those deaths. This is a problem that both Chairman Cummings and I share and are committed to addressing. As such, I'm glad that we have Director Carroll with us at the committee this morning, and I look forward to hearing about your office and its plan to combat the drug crisis our nation faces. Director Carroll oversees the Office of National Drug Control Policy, which was reauthorized last Congress by this committee on a bipartisan basis. While it is hardly the only office within the administration focused on combating drug addiction, it plays a crucial role in this effort, and we must ensure that it succeeds in its mission. Now, the title of this hearing is the Trump administration's response to the drug crisis. Well, we can all agree that this nation is facing a crisis. We've said it several times already this morning. It is not a crisis that started on January 20th, 2017. It is a crisis that's been years in the making and one that continued to worsen under the prior administration. The Obama administration demoted the ONDCP from a cabinet-level position in 2009. A 2016 GAO report found that Obama's 2010 National Drug Control Strategy made moderate progress, but none of the strategy goals have been achieved. More recently, in response to the devastating increase in drug overdose deaths and opioid misuse, important and timely changes were enacted to address the crisis. For instance, the Trump administration declared a public health emergency. Congress has passed legislation providing funding directly aimed at the crisis, and Federal agencies have taken aggressive steps geared toward the scaling back of opioid use. In 2017, the President convened a commission on combating drug addiction and the opioid crisis, and last March, the President announced an initiative to stop opioid abuse and reduce drug supply and demand. Additionally, law enforcement agencies across Federal, State, and local entities continue to work tirelessly to prevent the flow of illicit drugs into the country by patrolling our borders and disrupting drug trafficking organizations. In January, Customs and Border Protection agents arrested an individual trying to cross the border into the country from Mexico with a record amount of fentanyl. The agents seized enough fentanyl, think about this, enough fentanyl to kill 57 million Americans. We know that combating the supply and demand of drugs in this country is not a one-size-fits-all approach, but a great place to start would be doing what we said, actually securing the border. The opioid crisis does not strike each state or each community in the same way. What prevention or enforcement efforts may be effective in one area may not work in another. It is imperative that we equip states and communities with the resources needed to reduce drug supply, prevent illicit drug use, and provide needed treatment. But it is not a problem that funding alone can solve. We need to thoughtfully empower each community to address its unique needs. An essential key to curbing illicit drug use is coordination between Federal, State, and local entities. To that end, both of the grant programs housed in ONDCP, the Drug-Free Communities Program and the High-Intensity Drug Trafficking Areas Program, play a critical role in assisting and helping local communities in preventing and reducing illegal drug supply and demand. I want to note that I appreciate the Chairman having 2 hearings this week on important issues that our committee has legislative jurisdiction over. When this committee does its best work, it is done on a bipartisan basis, and it focuses on improving government efficiency and effectiveness. However, while the mission of ONDCP is crucial and our vigilance is proper, I think it's important to note that just last year we reauthorized ONDCP. In that reauthorization, ONDCP was equipped with various reforms to ensure it has an effective coordinating body. And I think, Mr. Chairman, you and I can both agree that we want the office to succeed. So while oversight and focus here is certainly proper, I hope that we do not prematurely judge these efforts and remain optimistic about the progress that we all expect to see. That being said, I look forward to hearing from Director Carroll about how his office and his agency and its grant programs can effectively coordinate a response to the epidemic. This is a seminal public health crisis in our time. I also look forward to hearing from GAO and the HITA program. I want to thank all of you for the time that you have spent to be here, and I look forward to hearing from you in just a few minutes.